All right, future doctors, welcome. Today, we're doing a high-yield deep dive into a topic that's, well, at the very heart of biochemistry and physiology, plasma proteins. Now, these aren't just some random bits floating around in your blood. Nope. They are the absolute workhorses, the unsung heroes, doing everything from fighting off germs to literally stopping you from bleeding out after a paper cut. So, let's get right into it.
So here's our game plan. First, we're going to meet the whole team, all the plasma proteins. Then we'll put a spotlight on the star player, albumin, and its very important supporting cast, the globulins. After that, we'll see how they act as our body's defense force and as first responders when it comes to blood clotting. And finally, we'll tie it all together so you can see how this stuff shows up in actual clinical scenarios. Let's begin.
First up, let's meet the plasma proteins. But before we can really understand the players, we have to get to know the field they play on, and that is the plasma itself.
Okay, this is a classic point of confusion, so let's clear it up right now. Plasma versus serum. Here's the absolute key difference. Plasma is the liquid part of your blood before it clots. You get it by adding an anticoagulant. This means it has everything in it, including the crucial clotting protein, fibrinogen. Serum, on the other hand, is the liquid that's left over after the blood has clotted. So what's missing? The clotting factors. Simple as that. Serum is plasma minus the clotting factors.
So, how do we actually see all these different proteins? Well, the go-to technique is called electrophoresis. I want you to imagine it's a racetrack. We put a drop of plasma at the starting line on this special gel, and then we flip a switch to apply an electric current. Now, based on their charge and size, some proteins are going to be like little Ferraris, and others are going to be a bit slower. They all separate out into these distinct bands. It's a really brilliant way to get a lineup of the whole protein family.
And here's what that race looks like at the finish line. Just look at this bar chart. You see that huge, massive peak? That's albumin. It is the front runner, no question about it. It completely dominates the landscape. Trailing behind it, you've got the globulins, which have separated into their own little groups, alpha, beta, and gamma. That gigantic albumin peak is exactly what we're going to talk about next.
Okay, let's zoom in on our main player, albumin. It's not just the most abundant protein we have, it's also got to be one of the most hardworking proteins in your entire body.
You know, I love thinking about it this way, like albumin is introducing itself. It would say, "Hi, I'm albumin. I'm kind of the most popular protein around here. I'm made exclusively in the liver, and I'm a total multitasker. I handle osmotic pressure, I'm a taxi service, and I even pitch in with nutrition." What a resume, right?
And calling it abundant is, well, it's an understatement. A normal concentration is between 3.5 to 5 grams per deciliter. Now, to put that into perspective for you, that one single protein makes up about 60% of all the protein in your plasma. It is absolutely the king of the castle.
So what does this superstar protein actually do? Well, its number one job, its main gig, is maintaining osmotic pressure. It acts like a giant sponge holding water inside your blood vessels. But it's also the body's taxi service, picking up passengers like fatty acids, bilirubin, hormones, you name it, and dropping them off where they need to go. And on top of all that, it's a backup energy source and helps keep your blood pH perfectly balanced, a true jack of all trades.
And here's where this becomes so important clinically. If your albumin levels drop, say in liver disease or severe malnutrition, that sponge effect gets really weak. Water starts to leak out of the blood vessels and pool in the surrounding tissues. And that causes that classic puffy swelling that we call edema. So here's your clinical takeaway. When you see a patient with generalized edema, one of the first things you should think is, I need to check their albumin levels.
All right, we've met the star, albumin. So now let's get to know the rest of the ensemble cast, the globulin family. And this isn't just one protein. It's a whole crew of specialists, and each one has a very specific job to do.
First up in the family is alpha-1 antitrypsin. Think of this protein as a bodyguard, specifically for your lungs. Its job is to neutralize a really powerful enzyme called elastase. If elastase were just left to run wild, it would literally chew up the delicate elastic tissue in your lungs. So this protein is absolutely crucial for keeping your lungs healthy and stretchy.
Now, let's connect this to a huge clinical point. For people who have a genetic deficiency of this protein, smoking is an absolute catastrophe. But why? Well, it's because the chemicals in cigarette smoke actually attack and inactivate what little antitrypsin they have. It's like taking their bodyguard completely offline. This leaves the lungs totally defenseless against elastase, and it leads to very early, very severe emphysema. Another really important globulin is haptoglobin. This one's more of a scavenger. See, when old red blood cells break down, they release all their hemoglobin. Haptoglobin's job is to swoop in and grab this free hemoglobin before it gets lost through the kidneys. Why? To recycle that precious iron. This is why in conditions where a lot of red blood cells are being destroyed, what we call hemolytic anemia, you'll see haptoglobin levels just plummet because it's working overtime trying to clean everything up.
Okay, now for a group of globulins that you have definitely heard of, the immunoglobulins. You probably know them better as antibodies. These are the highly specialized soldiers of your immune system, and they make up that gamma globulin fraction that we saw way back on that electrophoresis gen.
There are 5 major classes, and a fantastic mnemonic to remember them is GAMED. G for IgG is the most abundant, and this is key, it's the only one that can cross the placenta to give immunity to a fetus. A for IgA is found in secretions like saliva and milk, guarding all your body's entrances. M for IgM is the first responder. It's the first one on the scene during an infection. E for IgE is the one that gets involved in allergic reactions. And finally D for IgD, which helps activate other immune cells. Each one has a very distinct, very vital role.
So what happens when this amazing antibody-making system goes haywire? Well, in a cancer called multiple myeloma, a single clone of a plasma cell starts dividing out of control. It just churns out massive amounts of a single useless antibody. So when you run an electrophoresis on their blood, this flood of identical protein shows up as a huge, sharp spike. We call it an M-band, and it's a dead giveaway for the disease.
Okay, let's switch gears to another absolutely critical function of plasma proteins, stopping you from bleeding. We're talking about the coagulation cascade. Now I know it can look really complicated on paper, but we're going to break it down into a simple, logical sequence.
I want you to think of the clotting process like a set of dominoes. You have a few different starting pathways, but they all converge on one critical domino, activating factor X. Once factor X is turned on, it immediately knocks over the next domino, converting prothrombin into thrombin. Now, thrombin is the master enzyme here. It takes our soluble protein, fibrinogen, and snips it, turning it into these sticky, insoluble fibrin strands. These fibrin strands then link together to form a mesh net, trapping blood cells and forming a solid clot. That's the whole goal.
Of course, if any of those protein dominoes are missing from the set, the whole cascade just fails. And that's exactly what happens in the famous bleeding disorders, the hemophilias. In hemophilia A, which is the most common type, patients are missing factor 8. In hemophilia B, they're missing factor 9. In both cases, the chain is broken and a stable clot just can't form properly.
Wow, we have covered a huge amount of ground. So now let's wrap things up by bringing it all together. We'll focus on the clinical side and do a quick review to really make sure this knowledge sticks. We've talked a lot about forming clots, but in medicine, a lot of the time we actually need to prevent them. That's where anticoagulants come in. They work in a few different ways. Some, like the citrate they use in blood bags, just bind up all the calcium, which is an essential ingredient for clotting. In the clinic, a drug like heparin works by supercharging our body's own natural clot blocker. And then there's warfarin, which takes a totally different route. It stops the liver from even making some of the key clotting factor proteins in the first place.
All right, final pop quiz time. Let's see what you've retained. Of the 5 classes of immunoglobulins we talked about, that gamed mnemonic, which one is the only one that can cross the placenta and give passive immunity to the fetus? I'll give you a second to think. Got it? It's IgG. Yes, that is an absolutely high-yield fact to lock away for your exams.
And that is our whirlwind tour of plasma proteins. From electrophoresis to edema, from antibodies to anticoagulants, you now have a really solid foundation on this incredibly important topic. Fantastic work today. You've just mastered another key concept in biochemistry. Keep that momentum going.